Hello friends, most of the vegetarians and vegans lack vitamin B12 in their body because of B12 deficiency. Diseases like megaloblastic anemia, central nervous system diseases like dementia, depression, nerve diseases like peripheral neuropathy occurs. So to avoid these diseases and stay healthy, we need to eat healthy foods containing vitamin B12. So which food should be eaten to avoid vitamin B12 deficiency in vegetarian persons? And what are the causes of vitamin B12 deficiency? Which diseases are caused by vitamin B12 deficiency? How should we diagnose vitamin B12 deficiency and how to prevent it? In this video, we will discuss about these topics in detail. I am Dr. PrashantMore and I welcome you on Dr. More Health Tip channel. Friends, most of the Indians, about 75% lack vitamin B12. There is deficiency of vitamin B12 because the Indian diet is mainly vegetarian. As vitamin B12 is present in animal foods and in dairy products, as intake of these foods is less in India, so vitamin B12 deficiency is commonly seen. Normal level of vitamin B12 is 300 to 900 picogram per ml. Borderline values are between 200 to 300, and if the values are below 200 picogram per ml, it is considered as vitamin B12 deficiency. Vitamin B12 cannot be stored in the body and it has to be supplied by the diet regularly to avoid vitamin B12 deficiency. Vitamin B12 is very important for making red blood cells, for making DNA, and it is also important for the healthy central nervous system, spinal cord and peripheral nerves. Vitamin B12 is also important for healthy brain, spinal cord and peripheral nerves. The average recommended amount of vitamin B12 is 2.4 microgram per day in adult, and in breastfeeding ladies and pregnant ladies it should be around 2.7 to 2.8 microgram per day. Now we will discuss about what are the causes of vitamin B12 deficiency. The two main causes are inadequate intake of the vitamin B12 in diet, and second cause is inadequate absorption because of various diseases. Like in atrophic gastritis, there is a thinning of wall of the stomach and it leads to less absorption of vitamin B12. In case of pernicious anemia, there is a deficiency of intrinsic factor and therefore vitamin B12 cannot be absorbed. In the patient taking certain medications like proton pump inhibitors, pantoprazole, omeprazole, esomeprazole, patient taking S2 blockers like cimetidine, ranitidine, vitamin B12 deficiency is seen. In case of diabetes patients who are taking metformin, because of metformin absorption of vitamin B12 is hampered. The people who are suffering from the various intestinal disorders like Crohn's disease, celiac disease, parasitic infestation of the intestines, in these patients also vitamin B12 deficiency is seen. The obese people who have undergone any surgery for obesity, these people also face vitamin B12 deficiency. In pregnant and breastfeeding mothers, vitamin B12 deficiency is seen as requirement is more in these ladies, and as it is less, it will affect the development of the newborn child. So adequate levels of vitamin B12 are very important in pregnant and breastfeeding mothers. Vitamin B12 deficiency is commonly seen in vegetarian and vegan people as they are taking very inadequate dairy products and meat in their diet, and because of this, as vegetarian diet has very less amount of vitamin B12, most people suffer from vitamin B12 deficiency. In India also people eating non-veg, they eat occasionally, and in these people also vitamin B12 deficiency is seen. So vegetarian people should eat certain foods to avoid vitamin B12 deficiency. At the end of the video, we will talk about what foods are vitamin B12 rich, and it should be regularly eaten by the vegetarian and vegan people to avoid vitamin B12 deficiency. Now we will discuss about the symptoms of vitamin B12 deficiency. Vitamin B12 is important for synthesis of red blood cells, and in its deficiency, the RBCs are not formed well. It leads to megaloblastic anemia, and because of this, patients suffer from fatigue, lightheadedness, weakness. Vitamin B12 is also important for brain, spinal cord and nerves health. Nerve problems like tingling and numbness in hands and leg, muscle weakness, and patient is not able to walk properly. Patient also develop vision loss. The mental problems like depression, dementia, memory loss, behavioral changes are seen in vitamin B12 deficient patients. Also GIT problems like constipation, diarrhea, gas and loss of appetite is also seen. Patient also complained of palpitation, shortness of breath and pale skin is also seen in such patients. So these are the symptoms of vitamin B12 deficiency, and some of symptoms are present in you. You should check your vitamin B12 levels. How diagnosis of vitamin B12 deficiency is done? The patient having vitamin B12 deficiency suffer from megaloblastic anemia, peripheral neuropathy, dementia, or in some patients symptoms are absent. So it is very important to check hemoglobin level in such patients, and vitamin B12 levels are measured. If vitamin B12 levels are between 300 to 900 picogram per ml, it means that the levels are normal. If below 200, it means that patient is vitamin B12 deficient. The other tests like bone marrow test for intrinsic factor deficiency, ceiling test also done in specific patients depending upon what is the cause of vitamin B12 deficiency. Now what is treatment of the vitamin B12 deficiency? If patient is suffering from pernicious anemia or any absorption related disorder, such patients will need injections of vitamin B12. Vitamin B12 shots are given to avoid vitamin B12 deficiency in these patients. Patient also given tablets of vitamin B12, and this vitamin B12 tablet replenish the deficient levels of the vitamin B12 in the body, and the condition of the patient returns to normal in some months. But if the nerve damage is very severe, then this will not be reversed and it will be permanent. So it is very important to maintain adequate levels of the vitamin B12 in your body to avoid permanent nerve damage. Also friend, the patient who was taking insufficient supply from the food are advised to take adequate amount of the vitamin B12 from diet. The people who eat non-vegetarian foods like chicken, mutton, poultry, eggs, these people will get adequate amount of vitamin B12 from the non-veg food. And the vegetarian people, they should eat milk products like milk, curd, cheese, yogurt, and these people will get the vitamin B12 from the milk products. The vegetarian people also can eat the fermented rice or nutritional yeast, as fermented rice and nutritional yeast have adequate amount of the vitamin B12. So how fermented rice is prepared? Now cool down the cooked rice and soak it in water, keep it for 12 hours, and after 12 hours this rice will ferment. Now discard the water and you can eat this rice with curd or buttermilk. So this fermented rice contains adequate amount of vitamin B12. For fermentation, you can add some amount of curd or buttermilk to the cooked rice so that it will ferment very well. So fermented rice, which is used in India since many years in South India, is very good method, and this rice should be used by vegetarian people to avoid vitamin B12 deficiency. Also vegetarian people are advised to eat nutritional yeast. Nutritional yeast contain adequate amount of vitamin B12. It has nutty cheesy flavor and you can add it on salads, on scrambled egg, in your vegetable or on your rice. So it also adds taste of your food and provides the adequate amount of vitamins, minerals and proteins. I have provided the link of nutritional yeast in the description box. From here you can purchase it. Nutritional yeast is available in two forms, fortified or non-fortified. Fortified form contains ample amounts of vitamin B12 and other vitamins. So people who are vegetarian and vegan are advised to use fortified nutritional yeast. Also in the market, fortified cereals, fortified breakfast foods are also available, which are fortified with vitamin B12 and other important vitamins. So the people who are eating mainly vegetarian diet should use fortified foods to avoid vitamin B12 deficiency. Friends, prevention is always better than cure. I advise you to eat vitamin B12 rich foods and avoid diseases like megaloblastic anemia, central nervous diseases like dementia, depression, peripheral neuropathy, GIT problem, skin problems and eye problems. It will also add to your skin health and hair health. If you have any query, you can write in the comment box. Thank you very much.